For decades, we were told that after a certain birthday, desire fades, energy shrinks, and intimate well-being is something to remember rather than something to cultivate. The truth is kinder and far more hopeful. Your body at 60, 70, or beyond still holds remarkable capacity for sensation, connection, and vitality when you give it the right signals: warmth, safety, circulation, and patient attention. This is a respectful, science-informed, age-positive guide to intimate self-care in later life. It is not medical advice, and it is not about performance. It is about learning to listen to your body, supporting healthy blood flow, calming the nervous system, and approaching private time as a ritual of self-respect. You are not late. You are right on time. Let's begin by clearing the loudest myth. Intimacy is not a switch that you flip. It is a process. Especially after 60, the body often needs a gentler runway. Hormonal shifts, common medications, changes in sleep, and life stress can make on-demand arousal unrealistic. That is not a failure. It is biology asking for a slower rhythm. When you honor that rhythm, sensation becomes more available and comfort increases. Think of this as learning a new language with your body, one built on curiosity and kindness instead of pressure. Start by shaping the setting. Small details matter more than people realize. Choose a time when you will not be interrupted. Silence the phone. Lower the lights just enough to feel cozy, but not drowsy. If your hands are often cold, run warm water over them or hold a mug of tea for a minute. Trim and smooth your nails. Apply a fragrance-free hand cream so your touch feels soft rather than scratchy. Keep a glass of water within reach. These little signals, warmth, softness, privacy, tell your nervous system that you are safe. Safety is the door through which comfort walks. Help your circulation before you even begin. 3 to 5 minutes of gentle movement can make a powerful difference. Stroll slowly around the room, roll your shoulders, circle your ankles, and take a handful of steady breaths where the exhale is slightly longer than the inhale. You are inviting your heart and vessels to deliver more oxygen to your skin and muscles. If you have a favorite song, let it play quietly in the background and sway to it. The goal is not exercise. The goal is warmth. Breathing is the most underestimated anchor for intimate well-being. Place a hand on your belly and another over your heart. Inhale lightly through the nose for 4 counts, letting the belly expand. Then exhale gently for 6 counts, letting the shoulders drop. Repeat a few times. Longer exhalations calm the branch of the nervous system that revs you up, making room for a more settled state. If humming feels good, add a soft hum on the exhale. The vibration can relax your face and jaw, and that relaxation often echoes down the body. If you live with stiffness or arthritis, prepare your hands. Open and close your fists like a flower 5 times. Make small circles with your wrists. Press your palms together and hold for a breath, then release. These simple movements reduce tension and increase comfort. If your wrists are sensitive, consider a small pillow to rest them on so your arms don't carry your whole weight. Now invite your attention to arrive. Scan your body from crown to toes. Notice temperature, tension, or comfort without judgment. Is your brow tight? Soften it. Are your shoulders raised? Let them fall. Is your jaw clenched? Unclench it and rest the tongue lightly behind your teeth. These micro-adjustments send reassurance. Reassurance is not a luxury. It is part of the physiology of arousal in mature bodies. Moisture and comfort are central to intimate self-care at any age, and especially after menopause or with certain medications. Choose a gentle, unscented, water-based, or silicone-based personal lubricant that is compatible with your skin and with any products you use. Keep it handy as a symbol of respect for your body's changing needs. Using lubrication is not an admission of deficiency. It is smart, compassionate preparation that protects delicate tissues and turns potential friction into comfort. Approach your body with curiosity rather than goals. Many older adults were taught to measure intimate time by outcomes. That belief can steal the present moment. Replace it with a kinder frame. This time is for connection with yourself. Let your first touch be about welcome, not demand. Place a warm palm on your chest and breathe. Place another on your belly. Feel the rise and fall. Let your body know you are not in a hurry. Begin with broad, soothing contact on non-private areas. Slow, open-handed strokes along your upper arms, shoulders, back of the neck, lower legs, and calves send messages of safety to the brain. Pressure should be gentle to moderate, enough to feel grounded, not enough to chase intensity. If you like, use a neutral body oil or lotion on these outer areas to reduce drag on the skin. Notice textures. The fabric under you, the smoothness of your palm, the warmth rising where you touch. This is not filler, this is physiology. Skin is the largest sensory organ you have, and when it feels welcomed, your inner world often follows. If you carry tension in your abdomen or hips, give them a little attention. Rest both palms on your lower belly and breathe slowly. With light pressure, make a few broad circles around the navel, always within your comfort. Slide your hands to the outer hips and make small arcs downward toward the thighs. These motions are not about technique. They are about inviting blood flow and telling nearby muscles that they may soften. Many people find that when the hips and belly relax, the whole body becomes more receptive. Pay kind attention to your back. If you are lying down, slip a small pillow under your knees to reduce lower back strain. If you are seated, place a cushion behind the low back. Posture changes the way blood moves and the way your nervous system reads your body. Comfort is not a luxury here. It is part of the recipe. Your pelvic floor, those deep muscles that support your organs, benefits from gentle, mindful engagement. Think of them like the diaphragm of your pelvis. Try this simple pattern. On a slow inhale, imagine that area blooming and widening. On a slow exhale, imagine a light, effortless lift, then a complete release. The release is as important as the lift. If you have been told you have a tight pelvic floor, focus more on the bloom and release, less on lifting. If you have been advised to strengthen those muscles, keep the movement small and comfortable, and avoid holding your breath. This quiet coordination supports circulation, responsiveness, and confidence without strain. If you choose to include your chest, approach it with the same broad, patient touch. Warmth and slow rhythm matter more than pressure. For many people, this area holds a lot of emotion. Let your touch be an act of kindness toward yourself. If tender spots arise, lighten your contact and breathe there. Discomfort is a cue to adjust, not to push through. Allow your mind to wander to memories that make you feel cared for. The weight of a warm blanket, a morning sunbeam, a friendly laugh. Positive recollection is not a distraction, it is chemistry. It can release feel-good messengers that make your skin more receptive and your muscles less guarded. If your mind drifts to errands or worries, that is normal. Gently invite it back with the breath. Inhale, exhale. Nothing to perform, everything to explore. If you decide to bring attention to your most private areas, let comfort lead every step. There is no rule that says you must. There is no schedule. If you do, use lubrication generously and keep your pace unhurried. Think in terms of warmth, pressure, and breath rather than intensity or speed. If any sensation feels sharp, burning, or irritating, pause. Add more lubricant. Return to broader touch on the surrounding areas. Your body will tell you what is kind if you give it time and you listen. Pain signals are information. Honor them. For those who experience dryness, delicate tissues sometimes respond well to regular, non-irritating moisturization on non-intimate skin as part of your daily routine, alongside adequate hydration and gentle movement. Some people also find that a warm shower or bath beforehand softens tissues and calms the nervous system. If you have questions about products designed for long-term moisture support in intimate areas, a conversation with a trusted clinician can be helpful. Your comfort deserves personalized guidance when needed. Medications can influence desire, arousal, and sensation. Common examples include certain blood pressure drugs and antidepressants. Never stop or change a medication on your own, but do feel empowered to talk with your care team about side effect profiles and options. Sometimes small timing adjustments or different formulations can reduce unwanted effects. If you live with diabetes or cardiovascular conditions, know that stable blood sugar, steady blood pressure, and regular gentle activity support intimate well-being by improving circulation and nerve comfort throughout the body. Men sometimes notice changes in firmness or timing with age. Women often notice changes in lubrication and tissue comfort. These are common experiences, not verdicts. Whole body practices, walking after meals, light strength work twice a week, stretching your hips, steady breathing. Help because they touch the upstream systems, blood flow, nerves, and recovery. Intimate self-care is part of that ecosystem. It complements, rather than replaces, those daily supports. If you live with arthritis in your thumbs or fingers, consider tools that reduce strain on your hands during massage of non-private areas. A soft massage ball for your calves, a foam roller for your outer thighs, or even a rolled towel. For private time, positioning can make all the difference. Extra pillows under knees or behind the back reduce effort and help you focus on sensation rather than holding yourself up. If neuropathy is part of your story, warmth and slow buildup of touch are especially important. Let the skin and nerves acclimate and keep your expectations gentle. Sensitivity can fluctuate from day to day. Meet yourself where you are. Give yourself permission to pause. If your mind gets distracted, if a wave of sadness arrives, if your body feels unsure, stop and breathe. Place a hand on your heart. Remember that this practice is not a test. It is a conversation. Some days, the most intimate thing you can do is treat yourself tenderly and try again another day. That kindness is not separate from desire. It feeds it. If you want to weave this into your week, think of a 3-part rhythm. Warm up, explore, restore. Warm up with short movement, warmth, and breath. Explore with broad, patient touch and optional, well-lubricated attention to private areas only if it feels right. Restore with a glass of water, a few deep breaths, and a simple note to yourself about what felt comfortable. The note matters. Over time, you will discover patterns, times of day you prefer, positions that feel best, songs that relax you, textures you like, and ways of breathing that help. That personal map is worth more than any script. Here are some gentle inspirations from people like you. A woman in her early 60s set aside Sunday afternoons as her private time. She began with a warm shower, applied a plain moisturizer to her arms and legs, and listened to a favorite instrumental playlist. She noticed that the slower she moved, the more present she felt, and the more present she felt, the kinder her thoughts became. Kind thoughts made everything easier. A man in his late 60s started pairing a 10-minute walk after dinner with quiet time before bed. He was surprised to find that the walk, just a neighborhood loop, made his hands less cool and his mind less busy. That steady calm changed how he approached his own body, with patience instead of push. A couple in their 70s agreed to schedule separate evenings each week for solo self-care, then share a cup of tea afterward. The result was more openness in conversation and less pressure when they were together. Privacy and partnership became teammates. If sleep is a challenge for you, know that unrushed private time can help by gently activating relaxation pathways. Keep the lights warm and low. Finish screens well before you begin. Thoughts will try to join you. Let them pass like birds across a window. If you notice restlessness, try a simple count. Inhale 1, exhale 2, inhale 3, exhale 4, and so on, up to 10. Then begin again. It is not a contest. It is a way of anchoring yourself in the body you inhabit, right now, with care. What if you feel self-conscious about your body? Many do. Start by shifting your language. Instead of asking, "Why doesn't this work the way it used to?" ask, "What would kindness look like for me today?" Instead of, "I should feel more," try, "I will give myself more time." Replace mirrors with candles if that helps. Wrap yourself in a soft robe or blanket until you are ready. Confidence does not precede care. It grows from it. If you have had discomfort during intimacy in the past, approach this with extra gentleness. Use more lubrication than you think you need. Favor broad, slow touch over focused pressure. Avoid anything that creates friction on delicate tissues. If discomfort persists, seek support. Pelvic health specialists, physical therapists, nurse practitioners, physicians work with adults in every decade of life. Asking for help is not a defeat. It is a smart investment in your comfort. Consider creating a small ritual that signals the beginning and end of your time. At the start, you might light a candle or take 3 deliberate breaths. At the end, you might place both hands over your heart and say, "Thank you, body," then sip water and stretch. Rituals help the brain transition into and out of private space with respect. That respect is part of healing the unhelpful messages many of us absorbed about aging and intimacy. Nutrition and daily habits also influence intimate well-being. Stable blood sugar supports steady energy and nerve comfort. Hydration aids circulation and tissue moisture. A short walk after meals stimulates blood flow and digestion. Gentle strength work maintains muscle, which is a friend to every system that supports intimacy. Morning light helps your sleep rhythm, and better sleep helps everything else. None of these are dramatic. That is their power. The small things, repeated, tilt your biology toward responsiveness. If you share life with a partner, solo practice can be a bridge, not a barrier. When you know what helps you feel comfortable, you can communicate it with clarity. Slower at first. More warmth. Less pressure. These are not criticisms. They are gifts of information that make connection kinder for both of you. And if you choose to keep this practice purely private, that is equally valid. Your body is your own. Let's talk about expectations. Cultural stories often promise a particular kind of experience and timeline. Those stories were written for ratings, not for your well-being. Your timeline can be shorter or longer. Your sensations can be subtle or pronounced. None of that defines your worth. The only measure that matters here is whether you feel safe, respected by yourself, and a little more alive when you are done. If emotions surface, a wave of grief, a flash of frustration, take it as a sign that you are touching deeper layers of your experience. Pause. Place a hand on your heart. Breathe slowly. You can journal a few lines if that helps. Emotions do not mean you are doing something wrong. They mean you are human. As you build this habit, you may notice changes that seem small from the outside and large from the inside. Warmer hands, fewer moments of tension in your jaw, an easier time falling asleep, more patience with yourself, a gentler voice in your head, and a quieter confidence when you dress in the morning. These are not trivial. They are markers of a nervous system that feels safer and a circulatory system that is responding to your care. Above all, let your practice be sustainable. 10 minutes counts. 5 minutes counts. The day you only breathe and place a hand on your heart counts. You are not building a performance. You are building a relationship with yourself that honors the body you have today. If you want a simple way to remember all of this, let it be this: warmth, breath, slowness, comfort, kindness. Warmth invites circulation. Breath calms the system that blocks sensation when it is stressed. Slowness gives your body time to join the moment. Comfort protects delicate tissues and quiets guarding muscles. Kindness keeps you out of judgment and in curiosity, which is where pleasure grows best at every age. You are not broken. You are changing. Changing bodies respond beautifully to respectful attention. The more you treat yourself with patience, the more your body trusts you, and trust is the foundation of intimate well-being at any age. If this message resonates, give yourself permission to try a gentle ritual this week. Choose a day, choose a time, prepare a soft setting, breathe, and let curiosity lead. Notice what feels welcoming and what does not. Adjust next time. This is a partnership with your own body, renewed in later life with wisdom that younger versions of you simply did not have. Share what you learn with someone who might need this hope. And if you want more calm, clear guidance on vitality, circulation, confidence, and well-being in the years that matter most, stay with this community. You carry more potential than you were told. Treat it with care and watch it answer you back.